We will talk about seizures in children. What is seizures? Seizures is abnormal electrical activity of the brain. Brain usually is electrical active always, but if it happens uncontrolled and abnormal, and if it change of our behavior or our consciousness or our movement, it is seizure. Seizure can cause convulsions. This is convulsions, uncontrolled movement of your limbs or whole body, or person can loss of consciousness or twitching movements. Also, person can have staring spells. This is staring spell when person is looking into space and there's no expression on his or her face, no expression, no emotion. It's staring spell, looking blankly into space. Sometimes it is accompanied with feeling of fear or anxiety or deja vu or loss of consciousness. Now let's say what is the most common cause of seizures in children is febrile seizures. What means febrile seizures? When temperature, when person has fever, kids usually less than 6 years old, when they have fever, high fever, more than 102 Fahrenheit or 39 degrees Celsius, there is around 5% risk of febrile seizure. When kid has high fever, it's possible that this person can have seizure, and this seizure can be whole body convulsions, and for many parents it's very difficult to see the kids in such condition and kid losing consciousness, and there is movement and convulsions, and it's very difficult to watch if you are a parent. But good news is that febrile seizure is not epilepsy. It's not epilepsy. Common knowledge and common sense says that when we hear seizures, it means epilepsy automatically. But it's not true, because most common cause of seizure in children is not epilepsy. It's febrile seizure, which is benign condition, which usually affects kids before age of 6, and after this it will never happen with high probability. So it's not dangerous condition. Of course, you should do some safety measures. For example, you should place your kid on soft surface, remove nearby object, and you should turn them on their side to keep their airway clear, to breathe freely and prevent choking. What is the explanation of febrile seizures? Why it happens, we don't know, but it's possible that kids' brain system is immature, and for that it's difficult to handle for such high temperature, and that's why this uncontrolled electrical activity develops and it happens. Of course, after febrile seizure, it's advised to check neurologically children to exclude other neurological condition. But in most cases, it's totally benign. Second most common cause of seizure in children is epilepsy. Around 1% of children is affected by epilepsy. In many cases, less than 1%. What is epilepsy? What is its definition? It's recurrent, unprovoked seizures. So, in case of febrile seizure, we have trigger, and this trigger is temperature, high temperature, or rapid change of temperature. It's more accurate if we say that in many cases it happens not because of just high temperature, but rising rapidly of this temperature. But in case of epilepsy, we have now these seizures are recurrent and unprovoked. And even in epilepsy, we have wide spectrum, different types of epilepsy, and most common type of epilepsy is benign childhood epilepsy. And what means benign childhood epilepsy? It means that kid starting twitching their face, it's twitching, or smacking lips, or drooling, and it can happen several times per day or many times per day. And it's important that children will not lose consciousness at this condition. So they have this facial twitching or drooling or lip smacking, but they can have also numbness of face or numbness of tongue. It's common, but without loss of consciousness. And what is the prognosis of this condition, and what is the treatment? Treatment is antiepileptic drugs if required. If symptoms are severe, it's important, because in many cases there is no needed of no requirement of medication, and we should avoid over treating or over medication. That's why if symptoms are disruptive, or if symptoms are severe or frequent, then carbamazepine, for example, oxcarbazepine, and anti-epileptic drugs are used. What is the problem of anti-epileptic drugs? Because if you start them and if you're using them, you should using them long term, usually sometimes several years, and even you should continue them even symptoms are stopped. It's important to prolong intaking of anti-epileptic drugs to prevent relapse of the disease and prevent epileptic symptoms. Also, environmental factors are important. Reducing stress and maintaining regular sleep pattern is important. Second most common form of epilepsy is absence epilepsy. What means absence epilepsy? It means that there is lapses in awareness, and person has starting position, and it looks like that this kid is looking into space, and there is lapse in consciousness also, and awareness for 10 to 50 seconds usually. It can be provoked by stress, triggered by stress or hyperventilation, and such cases blinking or chewing or twitching also can happen. Such automatic movement also can be accompanied this starting appearance. And diagnostic criteria is electroencephalogram, and shows characteristic 3 Hz spike waves during the attack, during the seizures. And what is the treatment? Treatment is anti-epileptic medications also here, for example valproic acid or lamotrigine, or ketogenic diet. Ketogenic diet plays here important role if medications are not effective. What is the idea of ketogenic diet? It's intaking of fats and proteins, and restrict carbohydrates minimally to induce ketogenic state in our body. It's important that this ketogenic diet should be supervised to avoid other side effects, especially if it's long term. What are the prognosis of this benign childhood epilepsy and absence epilepsy? In both of cases, prognosis is very good, especially in case of benign childhood epilepsy. Prognosis is perfect because almost in most cases we have remission when adulthood occurs. So when kid becomes adult, these epilepsy symptoms will go away. even without treatment in most cases. So prognosis is almost perfect in case of benign childhood epilepsy, and in case of absence epilepsy we have 70% positive prognosis, that there's 70% probability that this disease will go away on itself even without treatment during adulthood. So but when we treat, when symptoms are severe and when there is problem during studying, for example, then of course medication is required for long term. So treatment is important. In this case, it's absence epilepsy. And what is the most common form of epilepsy which can occur during childhood and during adulthood? Also, it's temporal lobe epilepsy. It's very common form of epilepsy, which is characterized by convulsions, loss of consciousness, and classical form of epilepsy. And this temporal lobe is responsible on emotions and memory. And fourth form of childhood epilepsy is juvenile myoclonic epilepsy. It can start in childhood and it can last in adulthood also. That's why these two types of epilepsy are more serious forms of epilepsy compared to, but they are not most common. They are most serious but not most common. Most common is temporal lobe epilepsy in adulthood, but in childhood most common forms are benign childhood epilepsy and absence epilepsy, absence form of epilepsy. That's all I wanted to say. Thank you for your interest. Thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.